Hello, I'm Dr. Cedrick Gray, lead teacher for Jackson Public Schools, and welcome to another episode of Sup with the Sup. I am so excited you could join us today. We're covering an extremely important subject today involving our children's health. Our guest today is Dr. Timothy Quinn, the dedicated family healthcare physician and owner of Quinn Healthcare, PLLC. Before I get into today's shows, I want to take some time to thank all of our teachers, students, and employees for their hard work and dedication. This year, as every year, we're committing ourselves to providing the very best educational experiences possible. Our focus is on continuous improvement and communication. Teachers, I appreciate your unrelenting dedication as we continue to strive for progress that benefit all of our scholars. I have high hopes and expectations for our scholars and expect nothing less from our administrative team. Again, as I reiterate, this school year we are focused on 5 characteristics of high-performing schools, which are: number 1, scholar academic success; number 2, effective principal leadership; number 3, effective teaching; number 4, parent and community engagement; and number 5, scholar and adult recognition. My guest today is Dr. Timothy Quinn. As I've already mentioned, Dr. Quinn is a physician specializing in family medicine, and he is the owner of Quinn Healthcare, PLLC. Dr. Quinn, welcome. Welcome aboard, sir.
Hey, thank you for having me.
It's good to have you today. Man, I'm excited about this. Yeah. I have a million questions for you. But first, let me just start and get this out the way. So we are friends,
right?
And we do look alike, but we're not related, right? Okay, just so everybody know, we're twins. I wish I looked as good as you do. But I'm grateful that you're here today. You got height. I don't really quite, but anyway, never mind. I digress. Let's talk a little bit more about something that's more important.
Right.
Let's talk about something that's really near and dear to both our hearts, and that is the health of our children. So let us begin. I have so many questions, but I think I want to start right here. What are your thoughts about childhood obesity today and its dangers to our children?
Well, the deal is, as a family physician, we see the entire family from the grandparents all the way to the newborns.
Sure.
And, disproportionately, especially in our state of Mississippi, the rate of childhood obesity is on the rise. And it's very, negatively impacting our children's health.
Sure.
But it also sets a pattern for life. Most chronic medical conditions include diabetes, heart disease, kidney disease. All these things are very negatively impacted by someone being overweight.
Sure.
And usually if we have an increase in childhood obesity, that leads to adolescent obesity and adult obesity,
Sure.
which sets us up for failure in the future.
Sure.
So it's so important that, programming such as yours, tackles this issue and brings it to the forefront, because we got to realize that our children are our future.
Yes, absolutely.
And the deal is, you can have all the knowledge, you can have all the money, but if your health is not good, it's going to affect, your potential to be a leader in our future. So I think it's really important that we focus on this childhood obesity to protect our future.
Certainly. And I think you're absolutely right. And I often wonder, Dr. Quinn, what leads to childhood obesity? Every once in a while, I think even every once in a while have a greasy cheeseburger.
Right.
But can you talk to us about the factors that lead to childhood obesity?
Well, I think a lot of it has to do with the lifestyle.
Sure.
When I was a kid, we would. I remember the thing about the street light would come on,
right.
And you see kids running, trying to get home.
Right.
On a Saturday morning, we wake up, we might eat a little something, and we're out. We're playing, but times have changed. With the technology. Instead of kids playing football, we had one neighborhood against another neighborhood. Now it's all about these games, and kids are working their thumbs, but they're not getting that physical exercise.
Certainly. Gotcha.
In addition to that, I grew up in Macomb, which is a rural area, and it's maybe safer than Jackson or a more suburban area. But even in Macomb now, people they don't feel as safe as they used to, you know, so they guard their children, stay in the yard, don't go too far, don't go outside. And I think that because of that, you know, kids are not getting that activity.
Sure.
And then on the side of the diet, well, everybody's so busy, you know, times are hard. And there are a lot of single moms, single dads, and some parents that are together, but they're trying to make it. And what's happening is a lot of these parents are having to work 2 jobs. They're not home to cook for the kids.
Certainly.
So we're going into a fast food society. You know, it's always quick, you know, and convenient. But unfortunately, you know, those food preparations are not nearly as healthy as the mother cooking or the father cooking in the home. So between the, you know, decreased physical activity because of what we talked about, and then the increased calories, you know, we're having an epidemic of childhood obesity.
Right. Well, you make a good point, because I can remember as a child that my favorite thing to do after school and homework was ride my bike. And we would ride bikes all day long and all summer long. And you're right. So some of our children are now sitting more in front of the television or even in front of their electronic device.
Or their smartphone. I mean, we actually rode bikes, and we knew neighborhoods where the fastest dogs were. And we were so crazy, we'd take a can and put stuff in it and tie it up so the dog would chase.
The dog would chase it. You would run faster, You definitely ride faster with that.
But activity, things have changed. So that's why it's so important that we, you know, look at all this, and that way we can make society or our community more aware, and then we can start implementing some changes.
Certainly. Well, you know, with the onset maybe of childhood obesity, the question I think I would have is, are we seeing childhood obesity more in our younger elementary age scholars, or is this problem affecting all teens as well?
I'd say, you know, it's affecting all of people in our society. I mean, if you look at the statistics, you know, the rate of obesity has increased for all ages. You know, even the young, the adolescents, and the adults, and even the seniors. The deal is, you know, most children, they get into these habits. It's almost like a lifestyle, you know. It's just, it's really hurting our society. So, you know, we really have to get a handle on it. And I think through, you know, smart programming such as this, we can make people aware, because the deal is, if you're not aware of something, you're probably not going to make that change. Absolutely.
And the more aware you are of it, the more responsible you become because of it.
Right.
Absolutely. So since we're talking a lot about our children, you know, children report to somebody. And primarily speaking, that's our parents. So what can parents do to combat childhood obesity?
Well, the first thing that the parents have to do is make conscious decisions, you know, but as we keep going back, they have to be aware, you know. It's Saturday at, you know, 2 o'clock, and Johnny hadn't been anywhere all day. You know, you want to go to the park and play. Maybe just parents need to just try to get their children active again. Now, I as a physician, it's so funny because I had a parent the other day, and she was like, tell my son he doesn't need to play sports in school. He needs to be smart like you and be. I said, ma'am, I played every sport you can.
Right, exactly.
You know, get him involved in activities, and you as an educator, I'm sure that you can agree with me that when children are involved in activities such as sports, band, you know, different choir, whatever, not only do they get that increased activity level, but they develop critical skills that they can take into their adult life to set them up for success. So I think what the parents need to do, as I was saying, is be aware. Try to get their children more active. You know, take them to the park, let them play, take them to other children's house, get them involved in activities at school. And also, you know, just watch what they're feeding them. You know, one parent the other day told me, she said, "Well, my daughter, she won't eat she won't eat vegetables and fruits. She just wants like fried chicken and hamburgers." And I said, well, you know, you have to give it. She said she won't eat it. I said, well, let me ask you, is her name on the, does she pay the bills?
Does she have a job?
I said, you know, one thing we have to do as parents, and I have to, you know, watch myself on it. We have to be parents. And we have to remind them that we're paying the bills.
That's right.
You know, I have to, you know, talk to my daughter about it a lot, because she wants to eat the bad things. And I'm not going to say she can't ever, you know, go to Chick-fil-A or Wendy's or to the donut place, but we just have to set limits and do everything in moderation.
That's it. Moderation is important, and it's also important for parents to know that although children do participate in sports, there's a physical aspect to sports and activities after school, but there's also a mental aspect.
Oh, yes.
And so if you play ball, you got to know the plays. You got to know who's the positions and all of that. So there's a mental aspect to it as well.
Well, not only that, but you learn how to deal with people.
That's it.
You know, you got these people going into their jobs, and it's so unfortunate they're doing things to harm other people.
Right.
But some of these people may not have dealt with other people on that level of intensity and stress to realize that, you know, the bottom line, experience is everything.
That's it.
And children that are involved in sports, they get the activity, but in addition to that, they have experiences. They learn how to win, they learn how to lose, and they learn how to be successful after they lose to keep going to play again on the next Friday night. I tell you, you get me on football.
That's
all.
it.
I miss it so much, but I think it's wonderful for children to be involved in extracurricular activities.
Absolutely, absolutely. It helps build them up in many different ways. Let's talk a little bit about eye and hearing exams. How often should children have these checkups?
Well, I'm glad you brought that up. And you know, I'm working with the task force for the city of Jackson with Mayor Tony Yarborough.
Certainly.
And what we're doing is we're having community screenings, and we just recently had a screening where we had children come in to get vision and dental exams. And the whole premises of that was there are a lot of kids out there, like for instance, a child that came to visit me he came because he had like a rash, and I convinced the father to allow me to do a physical on the child.
Certainly.
Well, it turns out the child couldn't see the vision chart. Now, what we did was we referred him to an optometrist, Dr. Dampier, a good friend of mine, and the child was prescribed eyeglasses. Well, it was later revealed to me that the child was having a lot of problems in school. But now that he had the eyeglasses, he could see the board better. But the deal is with children, they have a hard time articulating, I can't see the board. Because vision deficits occur gradually over time. So he probably didn't even realize, you know, what was going on. He just knew that he couldn't see that well. When I got more history, he would sit in the back of the class because he was embarrassed. He didn't want to be called on. And his grades suffered. But not only that, his self-esteem suffered. But when he could see with the glasses, his self-esteem went up, his grades went up, and that kid is going to be successful.
Well, absolutely. Which brings to mind, how often should children get these regular checkups?
Well, it's recommended that children get a physical at least once a year. You know, and if something is discovered, such as that child that couldn't see the vision chart, well, they'll come back, you know, at a sooner time, but at least once a year, every child needs a physical.
Good, good, good. So, in your estimation, Dr. Quinn, based on your experience, what is the most crucial health challenge facing our young people today, and why?
I go back to the childhood obesity. And only because it sets you up to have medical problems later in life. Hypertension, diabetes, heart disease, all these are multifactorial, potentially chronic conditions. Meaning that if your parents have them, you can have them. But if you're overweight, then you have a much higher chance of having them, because that's a factor as well. So I think if we can, you know, horn in on childhood obesity, we could set children up to be healthy as adults and be productive in society for life.
Wow, that's powerful, man. Well, you know, it's been pretty informative thus far, but I think it's time for us to take a little bit of break, and I really love these kinds of breaks. This is an entertainment break. The entertainment break is coming up next, so let's pause to hear I Keep Getting Stronger from the Bates Elementary School Choir. Bates, let me hear you. Take it away.
Oh, keep my head up high, keep on reaching high.
That was beautiful. Let's give him a hand.
Right.
Awesome. Bates Elementary School, we are extremely proud of you and what you have done with our scholars. We're excited about that. Dr. Quinn, welcome back.
Hey.
Now, look, you talked a little bit about the task force that the Honorable Mayor Tony T. Yarber has you on. Tell us a little bit more about that and explain the impact you believe that's having.
Well, Mayor Tony Yarber took office in 2014, and he wanted to start a task force because Mayor Tony Yarber, he's really invested in the people of Jackson.
Certainly.
He's concerned about the education as he's worked with you and Jackson Public Schools. He's concerned about the economics, but he also has a very sincere concern about the health of the citizens of Jackson.
Right.
So what he did was he formed a medical task force, and I'm working with that task force, and we're trying to help, Jackson achieve a healthier status of health.
Good.
One of the things we're doing is we're going around to the different work sites of Jackson City employees, and every 2 weeks we do a different department. Like last Friday we did the fire department employees, and we did the police a couple of weeks before that, and what we do is we check blood pressures. But we're partnering with other organizations such as St. Dominic's, Virginia College, and a couple of other community nursing schools to do the screenings.
Sure.
We're also going into churches on Sundays, and we're checking blood pressures when people were released from church, and we go to a different church every Sunday.
Wow.
And we're working with University of Mississippi Medical Center on that. They're sending out the medical students. So it's a very good project.
Sure.
But I'm really excited about our third phase. We're having community health screenings. And we had our first one August the 8th, and it was at the Roadmap, which is right behind the medical mall on Woodrow Wilson.
Right.
And we partnered with optometrists and dentists. And basically what we did was we had a screening day where children would come out and be screened for vision and vision and dental issues, because as I talked about in the first segment, a lot of kids out there have problems seeing the blackboard or the chalkboard, and they don't articulate it, and their grades suffer as well as their self-esteem. But also there are a lot of children out there that might have dental problems. And they don't know how to articulate that, maybe for whatever reason. Maybe they're very young. And the deal is, we were able to diagnose a lot of kids with dental problems and vision problems and get them some help. So it's a really good project. We're getting ready to have our next one, and it's going to be focused on childhood obesity. It's going to be in the month of February, and it's going to be at the Metro Center Mall, and we're going to have like stations.
There you go.
Like there'll be one station, kids will be doing jumping jacks, and they go to the next station. But it's going to be a day that will continue to increase the health awareness, because what we're going to do is talk to the parents that bring the children and help them understand how important it is to implement physical activity into the life of a child. And also we're going to have dietitians that are going to be at some of the stations that will have like little cooking demonstrations and giving out free food. So I'm real excited. It's a really good project because it's helping the people of Jackson.
Absolutely. And the more we help the people of Jackson, the more prosperous the city becomes. Absolutely. You mentioned a little earlier about a young man who had difficulty seeing the whiteboard and how that impacted his esteem. And my experience as a teacher has been with things like eye problems, tooth problems, ear problems, and sometimes those particular scholars themselves, they can't articulate what's wrong. And instead of saying something about it, their behavior suffers because of it. So tell me a little bit about how poor eyesight or toothache can cause students to misbehave in class, and what parents can do to help correct that problem.
Well, you're so glad you said it, because I talked about the young man. One of the things he did when he got the glasses, he started moving closer up in class because the parent was in communication with the teacher.
There you go.
And she noticed all the changes. And this guy is sitting closer, he's raising his hand, he's participating, he's getting better grades. The thing is, before the child couldn't see. So he would sit in the back because he didn't want anybody to call him. But then he started acting out because I imagine he got bored. Just sitting in the back all day, so he would do other things, and he got attention, negative attention, but he kept doing it. So the bottom line is, the best thing parents can do is take your kids in for a physical. Because when kids come to get a physical, we check the vision, we check the hearing, we check we do a dental analysis, we check for diabetes, which is prevalent in some of our children, especially with the childhood obesity.
Certainly.
And hypertension. I mean, it's just a full workup. But another thing we check is behavioral issues.
Good.
And if we suspect that the child might have some type of psychological issue or related issue, we refer them to a psychologist for further testing.
Okay.
There are a lot of kids that have ADHD, and in a lot of cases it's undiagnosed, and these children are suffering as well. And I've referred countless children to a good psychology friend of mine, Dr. Dorothy McGill, and she's diagnosed children that needed medication or needed some type of behavioral therapy. And these children do miraculously well, as well as all the other kids. So the bottom line is taking your kid in for a physical can identify problems before it's too late.
Right. And so you said something that's resounding to me, and this is something that I think our community needs to be sensitive to, especially for those who compare our communities to others, to know that some of our parents either are not aware that they should do this, and some of them struggle financially to make these things happen.
I'm so glad
as
you
well.
said that.
Yes,
I'm
so
sorry
speak to me.
for cutting you off, 'cause I got excited about that.
Speak to that for us.
Here's the deal. I had a meeting with Magnolia Health last Friday. Magnolia Health is an administrative company that now administrates Medicaid. If you apply for general Medicaid, you can get traditional Medicaid, or you can have it administered by Magnolia Health or United Healthcare. There's also the CHIPS program, Children Health Initiative Program, for those that make too much for Medicaid. And if you make too much for CHIPS, chances are you have the ability to purchase insurance for the children. What I'm getting at is all children qualify for some kind of insurance in Mississippi 9 times out of 10. Now, here's the best part about it. Insurances pay for a physical for children, adolescents, adults, and seniors, even Medicare now, pretty much at no cost. Now, there are some exceptions, but very few. But Medicaid and the CHIPS program, if you take your child to get a physical, there's no out-of-pocket expense.
There you go.
So, you know, it's just parents don't know it. Now, another thing I wanted to touch on was during the meeting with the Magnolia Health, they told me that a lot of the children out there who qualify don't have insurance because the parents don't know that they can qualify and they don't apply for it. So it's so important that we get this information out there that children qualify for insurance. We just have to go fill out the paperwork and get our children insured, because if our children don't have insurance, that's a bad scenario. And I just want to leave one more in reference to that.
No, keep going.
When I was in college, I used to work as a nurse's aide. And I worked for an agency, and they'd send me around to different hospitals. Now, this is a true story. A child came in, and the leg was broken. And they showed the x-ray, and it showed that there was some displacement of the bone. It was kind of on the line, do a cast or do a splint. And they said, Tim, go mix the stuff. So I was getting ready to pour to mix the cast. And a nurse said, the child has no insurance. And they told me to put the stuff away.
Oh, man.
And you say that. You say, oh, man. But that's reality, because when you go to a hospital, the hospital is required to keep you alive. But if it's on the edge, there are unfortunate times when decisions are made based on financial benefit to the hospital or clinic. I mean, at Quinn Healthcare, we treat people no matter. The lady gave me some pecans. I told her I was going to make a pie. But as an older lady. But the deal is, you know, if you take your child to a hospital and you've not gotten that child insurance, there's a chance that the decision to treat aggressively versus non-aggressively, it can be impacted or affected by the fact that the child doesn't have insurance. Now, the deal is, wherever this child is today, there's a good chance this man now possibly has a limp because of a decision that was made. So it's so important that you get insurance for your children. And one last example, I had a child that had pneumonia, and I saw the child had no insurance. I just told her, Mom, just pay me whenever God put it on your heart. And I wrote prescriptions. Well, I got a call like 3 days later from the hospital. Apparently, even though I wrote the antibiotics, the mom didn't have insurance and she couldn't get them. If she would have had Medicaid, if she would have done the paperwork, the antibiotics would have been covered. But she couldn't afford them, so the child ended up in the hospital with, you know, pneumonia. So I don't know what that bill was going to be. I'm sure they got the emergency Medicaid once the child was in the hospital. But the bottom line is parents got to get their kids insured and and just know that they can take them for a physical at no cost.
Right, there you go. Well, we talked a lot about children's health. I'd like to talk just a little bit before we get out of here. How about giving the grown folks some health tips?
Hey, well, let me tell you this.
Okay.
You know, Jackson Public Schools has state Blue Cross Blue Shield administered insurance.
Certainly,
And
for the adults, yes.
most have a very high deductible, some up to $1,000 that they have to pay before the insurance will pay anything. The deal is they can go get a wellness at no charge.
There you go.
Now, you ask, why is it that the insurance will let you go get a wellness, which is kind of expensive, but if you have a cold or something, you know, if you go to the doctor, you have to pay out of pocket. Well, the deal is the insurance companies know that if you catch stuff early,
certainly,
it's going to save you a lot of money. And an example would be a lady that came to see me once with a very painful back. And she hadn't had a physical in over 10 years. She had the Blue Cross Blue Shield. I convinced her to do a wellness. And blood pressure, diabetes, everything clear. But when we did the breast exam, her left breast was hard as a rock. Okay? Told her to put her clothing on, sent her to St. Dominic's for a mammogram. I'm sorry, an MRI of her back. Now, another lady came, and this lady gets her physical every year. We did the breast exam, no diabetes, everything was perfect, blood pressure, but I said, I want you to get a mammogram. She didn't want to get the mammogram. I said, please go get it. It's covered, 100% with your insurance. She got the mammogram, and she ended up having what's called microscopic calcifications, which was early cancer.
Certainly.
She got an outpatient ultrasound-guided biopsy, removed the cancer. All the surrounding tissue was free. The radiological exams revealed there was no spread. Her cancer was caught before she had any symptoms.
Right.
The first lady, she got the MRI of her back. The entire vertebrae was full of cancer.
Oh.
Remember now, she hadn't been to the doctor in 10 years.
Right.
So if the first lady that had cancer, and all the surgeon told me for her was, there's nothing I can do, she just got to be on pain meds. I mean, it was in the liver, everywhere. Is just make her comfortable. If she would have gotten her physical every year,
certainly,
it would have been caught early like the second lady, and her life would have been saved. So that's why it's so important that everybody get a physical every year. And if you talk about diabetes, heart disease, the majority of medical conditions, including cancer, if it's caught early, the difference is night and day.
Well, you know what, Dr. Quinn, I'm going to get mine today. As soon as the show is over, I'm going to make sure we get checked out. Thank you for those tips, sir. Just as we wrap today, why don't you give us your overall outlook? You're a pretty optimistic guy. Overall outlook regarding the health of our young people today.
Well, I feel very optimistic about everything because of smart television like yours and people like Mayor Tony Yarborough who are in leadership, and yourself in leadership, who are actually concerned about health and understand the importance of making the community or helping the community become informed.
Certainly.
Because like we said before, when you know, then you can make a change, and that's what's happening right now. So I feel very good about our future.
Good, good. Well, my grandmama used to say, boy, when you know better, you ought to do better.
That's right.
And today, as a result of this show, our viewers, our parents, our community, they know just a little bit better about how to protect the health of our children. So, Dr. Quinn, on behalf of Jackson Public Schools, sir, we want to thank you for coming.
You.
Here's a little bit of a happy for you, sir.
Okay.
There's an umbrella in there. I'm not wishing for rain, but just in case, you'll be able to pop that bad boy open, and people will know that you are a friend of Jackson Public Schools. We appreciate you coming out today.
Hey, thank you for having me.
Indeed. So it was a joy indeed to have Dr. Timothy Quinn here for us. We are not officially twins, but we do look a lot alike, and I'm honored to be mistaken for you every time I go to the airport and every time I go by the hospital for some reason. They stop me and ask me, can they make an appointment?
Give them a card.
Pass your card out, I will. Indeed. So thank you so much. Well, once again, we thank you all so very much for joining us on another episode of Sup with the Soup. As I close, a little bit of a commentary. Here's the deal. Your superintendent, yours truly, you know how much I love your children. I love our children. We work hard every day to make sure they have the best education that this city can provide. We work together, and we will have exactly what we're looking for, a high-performing school district. It is on the way. As a matter of fact, it's right here, right now, all because of your help. Stay with us. This is going to be a super fantastic year, all because of your help. Until next time, my name is Dr. Cedrick Gray. I'm lead teacher for Jackson Public Schools, and thank you for watching another episode of Sup with the Sup.